Hi everyone, how you doing? My name's Gus. I'm a cosmetic and implant dentist based near London, near Heathrow, I guess, in the UK. Now, today let's talk about why we would, when we're placing implants for front teeth usually, why would we leave a bit of the tooth in? If you've seen my other videos, right, you'll know there's ways that we can really improve the look of our implants when we do implants for patients. And one of the biggest challenges we have is when the natural tooth is removed, the bone immediately sinks back. So if you're watching this and you've got one or two teeth missing, what you can do is just rub your finger over your gum, and where that tooth is missing, I bet you'll notice the gum just shrinks in. And that's because once that tooth has been removed, the bone shrinks down, okay? Now, from an aesthetic point of view, this causes massive problems for a lot of patients. And this is one of the reasons when we're doing an all-on-4 that we actually grind the bone down higher than the lip line. So you can't see that transition between gum and tooth, okay? Because we know it's always going to look bad because the gum shape has completely changed. Now for front teeth, it's slightly different because we don't have the option of grinding everything away. We have to make it look beautiful. And sometimes you'll get a situation, or I'll get a situation like this, where this lady had a crown on a front tooth, she had root canal treatment, she had everything done to this tooth, but it's broken down in such a way we can't rebuild on this tooth. So our options are either to remove the tooth, accept that we're going to lose bone, and quite often, last year or the year before, I would have just put the implant in using guided surgery and done a bone graft to help support the gum and reduce the amount of bone loss that we're going to get. And in addition, you can do a tissue graft to help support it. Now, this is all a lot of treatment, and quite often when I'm talking to patients, as soon as I start talking about bone and tissue grafts, they want to run to the hills. Now, in reality, for a single tooth, this isn't that big a deal, but there is another way. You see, what we found is that tooth doesn't need to be completely removed. So there are techniques, and if you want to Google this, you can Google partial extraction therapy or socket shield techniques. And these are techniques where the bit of tooth which is just behind that bone, which we know we're going to lose, we take the tooth out in such a way that we leave that piece of tooth there. And this doesn't cause breakdown. This means that we maintain and preserve the gum shape around that tooth. It means that we can avoid bone grafting in a lot of cases. It means we can also avoid tissue grafting as well. It's just a case of being very delicate when the tooth is removed. Now, this is another reason why I would always recommend, if you're in a situation like this and your tooth is broken down, your dentist has recommended having an implant, your dentist isn't the one who does the implant, it's always better to have a consultation with the person who does the implant before the tooth is removed, because you always have this option where you can just remove a part of the tooth and maintain the bone volume. You'll achieve a much better end result, better aesthetics, and with less treatment as well. Okay, with less treatment, we've got less cost as well. It's just a much more sensible way of doing this. And the less artificial stuff we can put in, the less bone grafting, things like that, in my opinion, that's a better thing. We get less complications due to infections and stuff like that. So it's an option, it's out there. I just wanted to make a video just to help explain that this is a possibility for some people. If you got something out of it, please click thumbs up, give it a like. If you like these kind of videos, please subscribe to them, and I will see you soon, guys. Take care.